guys, welcome back to my channel. In this video today I will discuss about MRCP PACES exam preparation. Our topics of discussion would be how to apply for the MRCP PACES UK exam, the dates and fees, exam structure, total number of including the total number of stations, how much would be the probable duration of preparation, what is the required study material, recommended courses, and how you are going to do the revision. So first of all, how to apply. So it depends upon if you are going to apply for the international center or if you are going to apply for UK. You need to apply through the same MRCP UK account that you are using for MRCP Part 1 and Part 2 exam. If you are applying for the international center, then just look at the dates in the MRCP UK website and apply in the given dates which are available for the international centers. For the upcoming exam, there are usually 3 dates which are conducted in 1 year, so you should see the dates which are suitable for you and apply in the window period of that. And if you are applying for the UK center, you need to apply in the midnight, so you need to stay awake till the 12 a.m. of the UK time to apply, because UK seats are available on first come first serve basis. So it's accordingly, while in the international centers there is nothing like first come first serve. In international centers it depends upon the availability of seats and how many times you have applied already, for how many years you are waiting, and how much is your time duration left for PACES attempts. So be sure that for UK center you need to stay awake in midnight, because they will not give you seat otherwise. Even if it is your first time to apply for the exam, or even if it is very early, you just pass your Part 1 and Part 2 and you are quickly applying for the PACES exam, applying in the midnight is a good chance to get a seat. But for international center, it's not like that. International center, they have priority of the previous candidates, number of attempts and all these. So what is the fee? Fee also, it varies from center to center. For international center, the fee is less, fee is more, while for the UK center, the fee is half. So the usual fee for UK, it's £657, while for the international center, the fee is 1,202. So it's almost £1,200. So it's double for the international centers. And next is exam structure. Recently, the exam structure of PACES exam is changed. The recent format, it also consists of 5 stations, but the stations are different. Now there are 2 communication stations. First station is about communication, 10 minutes, and then there is a respiratory examination also consisting of 10 minutes, out of which 6 minutes is with the for the clinical examination and 4 minutes are with the examiner for the viva. While for communication, all the 10 minutes with the patient. You don't need to go to the examiner for the viva and communication station. Then there is a 5-minute interval. Station 2 is clinical consultation, which is long form of previous station 5, which was basic clinical consultation. Now it is clinical consultation. It's consisting of 20 minutes, and in this station you need to take detailed history from the patient or surrogate, examine the patient. You should do the appropriate examination, do not miss out any important step, and finally you need to give out the viva with the examiner as well. There are usually 2 examiners on each station. One will be your main examiner and other will be observing examiner. In the next station, in station 1, communication and respiratory, one would be your lead examiner in communication, other one would be your lead examiner in respiratory station. Okay, so keep in mind that they will exchange their roles when there are 2 stations at a time. 2 cases at a time. So let's move to the third station. There is usually 5-minute interval between each station. Third station is cardiovascular. It is also having 10 minutes time duration in total, out of which 6 minutes are for the examination and 4 minutes are for the viva with the lead examiner. Then in the same station 3, there is neurology examination as well. You need to prepare the important cases of neurology. It's also the same, like 6-minute examination and 4 minutes of viva with the lead examiner. Then station 4 is having the abdomen case, which is GIT. The same pattern of 10 minutes, 6 minutes for the clinical examination of GIT and 4 minutes with the examiner. And in station 4, there is one communication as well with the surrogate only, no viva in this case. And then in station 5, there is again basic clinical consultation of 20 minutes, and in this 20 minutes you have got time for the examination, for the history and for the viva as well. So take a detailed history, do a good examination, don't miss out any important step, and then go for the viva. So this is the exam format. Total 2 communication, 4 clinical 4 clinical cases, and 2 basic detailed clinical consultation like the long cases. Okay. Next step is duration of for preparation. So it's a personal choice. It varies from person to person and your circumstances as well. If you are a new graduate and if you have less experience and less theoretical knowledge, so you may need more time. If you are an old grade and you are already having good clinical exposure, good clinical skills, and your theory is strong, then it may take for up to 3 months. But usually the time duration minimum is 3 months and maximum is 1 year, even if you are a new grad. So give yourself enough time, do the mocks and observe yourself how much you are prepared. Then apply for the exam, because this is not an easy exam and also it's not a cheap exam that you are going to take the try. But if you are confident enough and you are thinking that you have enough knowledge to go for the exam and enough skills, then I don't think that there is something that it's good to give a try. Even if you don't pass, if you don't pass, you get some experience, you get to know the exam. But of course, the best thing is to get through the exam and to pass in the first attempt. But no matter how many attempts you give, PACES is a good exam in this case, that you will learn each time more and more. You will become a better practitioner clinically. So let's move to the study preparation, study material and what you need to study. So study material, usually the one I used, first always start with the rider books. Although they are now, the edition is old, but they are good still. You need to study for the history and for the clinical communication. Study the rider for station of communication as well. Communication, clinical cases and history. But for the clinical stations like the examination stations, it's not good to read the rider. But for the theory station like the history station and clinical consultation and communication, rider for station which was old, station 2, 4 and 5. And rider has still classified their book accordingly, so read that. There is one book of rider for station 2 and 4, which is for history and communication. Do give it a read. Even the station communication is very good in rider, and station 5 is also very good. You can just make it more detailed, because your long clinical cases will be same like station 5 of rider book. Although they are a bit short, but you need to give more time to yourself, and you need to give more time for the examination, for the history. Make it long by making your own notes. Okay, so this is the first and foremost study material. Besides this, regarding the clinical stations of abdomen, respiratory, neuro and cardio, you need to study the OST if you are good enough, if you want a detailed knowledge, if you want to build good skills. So never miss this OST. It's a good study material for the clinical stations. Otherwise, there are many courses for the clinical station as well. Whatever mentor you are following, there are many courses in Egypt, in Sudan, in Pakistan, in UAE, in India. So whatever mentor you are following, you can read their notes as well. All of them are very good, and all of them have got their personal notes. So even in UK, if you are taking a clinical course, so do follow their notes, because whatever you are studying, whatever you are seeing and studying in the course, it's worth reading their own notes. Okay, so For me, I have attended the course in Pakistan, Dr. Imran Babar course, which is highly recommended, and I used his own notes for clinical station, and I studied OST as well. Besides this, there is one additional book which is called as Cases for Paces. This is a pocket book. This is very good book if you memorize each and every word of this book. Many people, they don't have much time. Like if you are, you think you have enough clinical knowledge, and if your theory is strong and you want to go ahead in 3 months time for the exam, so this is the best book to study. I will show the picture as well, so just see it. Pocket book of medicine. This is Cases for Paces. It's a very nice book to study and for the last time revision as well. And regarding the exam, it's very similar to the sample scenarios. Never miss studying the sample scenarios which are on official website of the MRCP UK. There is a separate bar of sample scenarios. Do take it. There are separate scenarios for each one of the station. Do practice them. Sample scenarios are separate for consultation, for clinical, and for each and every station they have, except the clinical cases. But clinical consultation, they do have the samples. Do read them and practice with your study partner. It's very important in PACES to have a study partner. Without study partner, I don't think, very few people I heard of, they pass the exam without study partner, but it's worth to have a good study partner who is positive and keeping you motivated all the time. Okay, so besides this, besides the sample scenario, whatever scenarios are coming in the day-to-day exam, like discuss with your colleague, stay in the WhatsApp groups, stay active in the Facebook groups as well. Many people are posting the past scenarios or discuss, if anyone, the cases which are coming in day-to-day exam. There are actually PACES does not have too much cases. If your clinical knowledge is strong, if your exposure is good, then it's very easy. They don't focus on minor details, but the major things you should not miss. If you have any colleague who is working in UK, it's better to discuss with them. Wherever you are confused in the communication station, it's better to ask from a UK colleague instead of an international colleague, because the one who is working in NHS, they can guide you better about their rules, about their legal principles. Okay, so next one is how the exam is marked. Actually, they are marking us on the basis of skills, and you need to pass all the 7 skills to pass the exam. Overall, it's a challenging exam because you need to pass all the skills. If you fail one of the skills, you cannot, and overall your score is great, is more even, you cannot pass the exam. Because to pass the exam, you should be able to pass all the skills as well. So there are total 7 skills which are examined in the exam, and you need to pass all the skills. I will mention one by one. Whenever you are preparing for the exam with your study partner, you should always look at the skills. So first skill is physical examination, which will be observed in all the station correctly. Second one is identifying physical signs. Also, it would be observed in all the stations. Third skill is skill C, which is clinical communication. It would be observed in your station 1, 2, 4 and 5. Skill D is differential diagnosis, which is observed in all the stations. Skill E is clinical judgment, which is observed in all the station as well. Skill F is managing patient concerns. This is very, very important. Many people fail in this managing patient's concern. Always ask the concern when 2 minutes are left, when your time is ending. Never miss the concerns, and you should ask it 3-4 times so that there should not be any concern left unattended. Okay, so it's usually asked in station 1, 2, 4 and 5. And final skill G is maintaining patient welfare. You should be able to score full marks in your patient welfare, because sometime if your exam is passed overall and you got margin in welfare, then they may fail you in this station, in this skill as well. So the most important, the skill which the people are failing, it's patient concern and physical signs. And always look at your weakness. When you are practicing with your study partner, keep the mark sheet in front of you. It's not for the first revision. First revision, go to through the study material. In second revision, keep the mark sheet in front of you. Practice your skills accordingly and score yourself. Either score yourself or give marks to your study partner, so that you can identify your weakness. Wherever you are weak, you can give more time to that skill. But always practice with reference to skills. If you fail a skill, you are not going to pass the exam. Please remember that the pass mark for each skill is 60 to 70%. Examiners are not looking for perfection, but they are looking for a safe doctor. So always try to be a safe doctor. And I will give additional tip what you need to do in 5 minutes when you are outside a station. Don't think about the previous station. Whatever you have done in the previous station, that's gone. Even if you have missed anything, it's going to have an effect on your next station. So this is very important tip. Once you are done with your previous station, leave it. Whatever happened, keep it there. But in this 5-minute gap, don't think about the previous station. Think about the new station. If this is an examination station, just try to memorize the examination steps on your fingertips, so that you will be active for the new one. Because if you are already stressed out from the previous station, and in this 5 minutes you will keep on thinking about them, and then you are going to this effect is being shown on your next station as well. So keep in mind, never think about previous station. Whatever done is done. Think about the new station in this 5-minute time. There are few points which can lead you to fail the exam. So always focus on these points. In examination technique, in physical examination skill, if you are not examining the patient in a systematic way, if you are using incorrect technique, if you are missing out significant parts of the examination, then you may fail an exam. Okay. If you look hesitant or lacking confidence, if you are examining in an unprofessional way, if you are examining the patient through their clothing, always expose the patient properly. Good exposure is very important. Then for improving your skills, you always need a supervisor. Whenever you are practicing clinical examination, always keep one person beside you to examine you, to look at you which skills you are missing and where you need feedback. Okay. Then in identifying physical signs, as I mentioned previously, it is very important skills because many people fail this skill. So you need to practice this very clearly. Don't make up the sign. Making up the sign, even if your 10 signs are correct and you have made identify one sign which is not present, then they will cancel all this effect. You will score 0 in physical sign. So if you find something you are unsure of, just skip it. Don't mention. It's not worth mentioning. Just skip it. Instead of failing the exam, it's better not to tell. If you are telling other 5 correct signs, then of course you will score some marks. But if you will tell one wrong sign, it will cancel to 0. Okay, so always discuss with your supervisor with your colleagues about observing you when you are examining the patient. Both your technique and examination findings should be accurate. Then in clinical communication skills, always focus on the history. You should be able to take a thorough history. Don't miss any important point in the history, like the social history, like the occupational history. Social history is considered very important in UK. They focus on these things too much. So don't miss out any important information, and always explain the clinical information in without jargons to the patient. Don't give inaccurate or unclear information. And if you are unsure of anything, like if you are still having differential diagnosis, you are not sure of your diagnosis, just tell the patient that I have this differential, I need to do this test to make my final diagnosis and to make it more clear for you. So don't give wrong information to the patient. Regarding the differential diagnosis, don't give a poor differential diagnosis. Always try to give the right differentials, and practice this skill very well as well. Then the clinical judgment, if you are not familiar with the correct management plan, if you suggest inappropriate investigation like which are not indicated for the patient, then this may lead you to score less. So correct diagnosis, giving a correct management plan is very important. Managing patient concerns, as I mentioned earlier, it is very important skill. You should listen to the patient or relative very carefully. If you are not exploring the patient concern in detail, this may lead to the unsatisfactory behavior, unsatisfactory pattern with the patient, that they are not satisfied with you. And if you are being over talkative to the patient, if you are not checking looking for the clues, especially in communication station, if you appear unconcerned and don't build a report directly, you are entering the room and breaking bad news, it's very unprofessional. And if you are running out of time to answer the concerns, then this is again considered not good. And welfare is important. Don't hurt the patient physically or emotionally by giving anything that by telling anything that is not worth to be told. And always tell them that I need senior review. If you're confused or if you're not sure of anything, tell them that you need senior review. Okay, so this is all about skills. Next one is revision. In revision, I have mentioned earlier that cases for PACES is a good try to go to do revision properly, and also do the revision of the cases which of the sample scenarios, and whatever you have studied, always revise them, because it's not important to study only, but it's important to retain whatever you have studied. You should retain it. That is more important. So do the revision in last 20 to 30 days and practice each and everything very well. Don't study too much, but whatever you study, it should be very clear. There should be no confusion. And recommended courses, for me myself, there are many courses which are available online. So whatever course you are thinking to attend, go with one patron. Don't over confuse yourself with many mentors. Always go with one, and according to your affordability. But it's worth taking a course, and especially if you're not confident enough, always take the active participant course. If you are having only 3 months time, take the active participant. If you're having more time, then first take as a listener to understand the scheme, then go for being an active participant. This is all about today. Next video I will make about special exam tip of MRCP PACES. Thank you guys. See you soon. If you have not subscribed to my channel, please do subscribe and like my video and share with your colleagues.